about statistics, which underscores the fact why I said every one of us has an opportunity to stop the spread. So 7.7, this is for the state of Ohio, 58,000 cases, 948, 804 was our 21-day average before that, so you can see how things are rising. Right, the address over 18, 134 over 66, and 24 over 15. So we're just seeing a little bit of that happening. Then fast forward to 7.9. So we go from 58 to 60,000. 1,200 cases. 846 was our average. Deaths, hospitalizations. A lot more hospitalizations we're seeing. ICUs, not so much because people don't seem to be getting as sick, like we talked about. The 20 to 39-year-olds may not need those ICU admissions as much, or the ventilators as much. Although I hear in Arizona, they're at about 86% capacity in their ICUs now, so a little bit rougher out there. And just thinking about why that would be, discussions surrounding the fact that it's hot there, obviously. So people go there for the dry heat, but they also like the air conditioning. So they're not staying outside, maybe going inside in congregate settings, being together, and the air conditioning's on, and we're circling. Being outdoors is a wonderful filter for the virus. All right, so let's fast forward now to 7.10. 61,000 cases, 1,150. Deaths have gone up. Hospitalization. So we're just seeing things. We knew what happened as we opened back up, but just an emphasis on making sure that we are doing all we can as individuals to stop the spread. And this is just a statistic from 7.7 that we had. It's just showing that it's going up. So this is hospitalizations. These are ICUs. Like we said, that's not huge, but somewhat. And then ventilators staying pretty consistent. Like I said, they just don't get as sick as they used to. Okay. So this was updated as of 7/8. They're only updated Monday, Wednesdays, and Fridays by our local health department. So I'll get some numbers today after 3. But as of the 8th, Wednesday, we had 146 cases. The day before that, I think was the time before they updated that, Monday was 138. A lot of those are coming from Put-in Bay. Thank you, Put-in Bay, for all that. So,
Does that count? Are they Put-in Bay residents? Are they, those numbers that are coming from Put-in Bay, are they residents of Put-in Bay, or are they visitors to Put-in Bay?
So those numbers count for our residents, for us. So the way that they kind of works out is that the county of residence, where you live, is what health department is reported to. So we have, employees from Put-in Bay live in South Carolina, they're from all over, Michigan, other places, and so their health departments will get that information. That will count for their numbers. However, because this is an outbreak now, Mike is still really involved in contact tracing and all those types of things. So we really need to keep those on the radar. For instance, the Ohio Department of Health has said they would do all of our testing, and all 1,000 of those results are going to go back to our local health department, and they'll look through all that. So they have to do the investigation at that point. Does that make sense to everyone? And then, did I put that in twice?
You're the 7th and then the 8th.
Oh, then the 8th. Okay, 7th and then the 8th. So that's where we saw kind of the increase from there. 146 on the 7th too, and the 8th update, 147. Okay, so just like I said, seeing an increase there. All right, so Governor DeWine put out a little while ago this kind of county alert level system, a procedure in place, which I think is a great idea to try to motivate individuals to modify their behavior if we're seeing spikes in different areas. Along with each of the colors come more restrictions, of course. If you're good, you have more freedom. If you're not good, not as much freedom. So if we start out at level 1, there's active exposure and spread. We're just going to follow all the current orders. Restaurants still can be open, while masking is completely encouraged, really encouraged. Social distancing is encouraged. Nothing's being mandated this yet. And as you move forward to level 2, then to level 3, and then to level 4. Franklin County, I believe, is at level 4 now. So they really need to be staying home. They're kind of back down to the shutdown orders, mandating masks, those types of things.
I think I just read that Franklin County had dropped back.
Did they go back down? Okay, thank you for telling me about that. which is a great thing, because hopefully if you, that's exactly what you want to see. Do you see what I mean? Once you start to put those measures back in place, then you can go back. Do you know what I mean? Based on the 7 different criteria that they use for this. It's kind of a little more complicated. So I think that that's a great motivator. That's what you want to see, is that if you're at this level, we do these things and we, you know, go down a level. So that's great. I think it's really smart that the governor put that in a way to put this in place in a way to try to, you know, like I said, modify behaviors. This is a little bit older one. Franklin again would have been purple, then it's back to red. And then did I hear somebody else went red too? So if you go red, level 3, exposure and spread, limit activities as much
I
as
think
possible.
Lorraine County's red now.
That's what I heard yesterday. You're exactly right. So this is just a concept to show you how, as we're moving forward, to hold people more accountable, hold the powers that be more accountable, those types of things. So that we can hopefully continue to see these kind of little spikes go back down again. Any questions about that at all? Okay. So Mercator Hospital, we tested over 900 patients. You can kind of see the numbers with that. We don't have anybody in-house right now. And then 1 positive actually moved to 2 positive as of yesterday, but I'm still really proud of that fact because that means that our PPE is working for our staff. You know, they are being protected with the measures that we have put in place. So I'm really happy about that. And they do see, you know, they see people coming through our ER a lot and our urgent cares a lot for the testing and stuff. So antibody testing has gone up a little bit more because now we're getting into our employee screening, but we're still seeing very, very low positives for them. Which means that the community hasn't been exposed. So yay to everybody who closed down and did what they needed to do. All right, so let's talk a little bit about what is Mercator Hospital doing to prevent the spread of coronavirus and protect you as you come back into the facility. So number 1, big thing, are masks. Universal masking. Making sure that have our face covered, because if you remember going back to that graphic where you see how that spreads, you can stop that by having a face covering on. Important that you make sure that you wear it over your nose as well, because you're just breathing out the same droplets through your nose as you are through your oral cavity. So we have to make sure that we're covering that as well. So cloth masks for anybody who's not working within our clinical setting, say those that are working in admin wing like myself or accounting, but those that are working in ER or med-surg or radiology or oncology, any of those areas, then they're going to wear the isolation or procedure mask, which look more like hers right there. We have yellow and blue ones here, I believe. Rach, do you have? No? So there's a little bit higher grade for healthcare professionals, but cloth masks are very effective as well. Okay, we're also limiting the flow of patient and visitor traffic. There's only 2 entrances that are open right now. That is the outpatient entrance and then our ER entrance. What we want to do is prevent having someone wandering throughout the facility who may be COVID positive, is not masking, is spreading. So we really put an effort towards making sure that we don't see those types of individuals here. And then at each of those 2 entrances, we go through a screening process with the patients and visitors, check the temperature, you ask for COVID-19 exposure, have you know anybody who's had it, have you been exposed, those types of things. And then also, do you have any symptoms currently right now? Our registration staff is the one that really carries the brunt of this, the screening process, and they're rock stars at it. Very grateful for them and all they do on the front line, because there are the ones saying, well, if you have some symptoms, we can't let you in as a visitor. Obviously, we're going to be treating people who are sick. People are here for testing, diagnostic things, because we have to know. So at that point, if they identify someone who doesn't feel well, or maybe has a fever, there's communication processes that happen between registration and all the different departments to let them know that we're bringing someone over, and so they can do the appropriate PPE and those types of things. So they've done a really, really great job. Deb Hall and her staff have done an amazing job in taking all of this. Okay, we're also limiting the number of visitors to inpatient areas. Only 1 visitor at a time. You can have more than 1 visitor on your list to visit, but only 1 visitor at a time. And then daily, the list of the people who can visit the patients is given to our registration staff. They cross-reference that, and if someone comes in, they'll call the floor and let them know. So again, they're doing a great job of communicating that. Another thing that we're doing too is the cafeteria is still closed to the public. I mean, we have the curbside service and all that stuff, but interior is closed to the public for just, except for employees and the volunteers when you come back. I have to give a shout out to Shelley Hillman as well. She's the director of food services. Again, super high functioning rock star. Done an amazing job of managing traffic. Very clearly demarcations of arrows about how you can move through the facility, the area, and where you should stand with stickers. She's done a great job with all of that. So I give her tons of credit. You also are going to see that now the silverware is all the individual dispensing. There's all disposable types of trays and those types of things. You'll see the guards throughout the facility too, like the plastic that you see everywhere. No more, obviously, long time we haven't had any of the self-serve salad bar and those types of things. So. Yeah, she's done a great job at that. Okay, oh, and then I want to just go back to this, and I should have added that. Another thing that's happening is obviously with infection prevention, I was always interacting with my employees about disinfecting between patients and then working with our EBS staff to make sure that we're using the correct chemicals and those types of things. But that's become even more heightened now. So between each and every interaction that they have, say in the physician clinics or registration or those types of things, disinfection is occurring between each and every one of those things now. So it adds a bit of time to, that's a lot of time actually to the duties that the staff have, but they've been great about it and understand the purpose. So that's what we did to protect you or everyone from the spread of corona within McGregor. What can we do as people to protect people from getting it or spreading it? Obviously wash your hands, big time hand hygiene, talk about that. 20 seconds, lots and lots of foam, and then rinse away. Hands down, so that's just blowing away all those bugs. I lost my train of thought, what I was going to tell you about that. But anyway, just make sure that you're not rinsing like this, so that, you know, they're just all flowing away. Okay, if obviously we don't have an availability of hand washing, alcohol-based hand rubs are very effective as well, as long as they're 60% or more. And then another thing is this big T-zone that we talk about here, and I'm horrible about it, not touching your face. So, face masks and face shields are excellent reminders not to touch your face. Well, we don't think that things can be, well, the CDC has come out and said that they don't think that the main mode of transmission for the COVID virus is from touching things and then touching yourself. It's more from breathing it in. Still behooves us to be mindful of touching the environment, perhaps rubbing our eyes or touching our mouths or things like that, because perhaps something could be introduced that way. All right. Avoid close contacts, especially if you have someone who is sick at home with you. I apologize to poor Rachel and to Kathy because I've heard these same stories over and over. My husband and I talked about what would happen if I ever had to go on the front line when we were starting all of this, and I may still. We are lucky enough to have a master bedroom on the first floor with bathroom, so I would just stand there, for my meals, the door knock on it, shove them in, whatever, you know, I grab them, and then he'd have them run the rest of the house. So it's really important to, if anybody's sick in your home, to kind of distance. And then our little pets too, because they can get the COVID. And then obviously outside of home, you've heard it over and over and over, social distancing, social distancing, social distancing, 6 feet apart. It's been really proven. Social distancing, face masks, and being outside really greatly reduce the spread of the COVID virus. I cannot say that enough. Being indoors close together, hence why we're seeing outbreaks of people into bars and things like that, when we don't have proper ventilation and things are just swirling and people are up close, has been proven to actually spread the virus. Okay. Face mask we talked about. Make sure, like I said, you cover your nose. Otherwise, it's not as effective. And we talked about this. The idea is that when you look at that big spread, if you cough or sneeze, the graphic that we looked at there, face masks are stopping it. They're protecting me from getting used to it. They're protecting you from me getting used to it. Okay. Now, I've gone out very few times just because I eat, sleep, and breathe this virus, and it's very, very, very on my mind all the time. And I kind of know how, know how it spreads and those types of things. So I think I've been maybe out 3 times. But the last time I went was Friday to the grocery store, and I was really disheartened to see the amount of people who didn't have masks on. I mean, I don't know the statistics for it, but me looking around, I want to say 95% people did not. So, that's kind of disheartening for me. I'd like to see that awareness change. And like I said, with the alert system, those color systems that we have, those things become more mandatory as you see, like going from yellow to purple. However, CDC does recommend that there are times when there are cases when face masks can't be worn. Anybody under 2 years old who might not understand the concept of being able to remove it or be able to communicate that they can't breathe. Cognitive, maybe some type of emotional issues, those types of things. That's why it can't be a complete mandate, it can't be a law. There's some thoughts about how it violates civil liberties, but independent of all that, I really like to encourage people to wear masks when they're out and about. Okay. All right. And then cover your cough campaign. I feel like the COVID virus is a cover your cough campaign on steroids, like huge. But I'm sure we're all familiar with those graphics. I know I've shown them before in my other presentations. Still, you don't have a mask on, you're home by yourself, it's even to your elbows so you're just not spreading out into other areas. Or if you're having a runny nose, or what we call leaky patients, making sure that you're disposing of your tissues very quickly and then performing hand hygiene afterwards. Just trying to keep it all contained and not spreading. All right, we talked about soap. You can wash your hands, and then the hand sanitizers as well. Same thing with hand sanitizers. You want to make sure that your hands, that you put enough on, a big enough dollop, maybe the size of a dime, enough so that your hands stay saturated for 20 seconds before it starts to evaporate. And really a lot of friction with that too. Okay, clean and disinfect. We talked about what we're doing at Recruiter here to make sure that we're cleaning in between each patient interaction or patient encounter, those types of things. But at home, same thing. Any high-touch surfaces, please make sure that you're cleaning those multiple times a day. That goes for anything, really. Influenza season. I'll digress a little bit here, but my grandmother always said it's an ill wind that blows no good. So I think COVID-19 is going to bring much more awareness to influenza. The World Health Organization itself has ordered many, many more vaccines from our manufacturers because they're anticipating it's going to be a gangbuster year for people who are getting vaccinated for the flu. Delighted about that. So that's just a positive from the COVID. But going back to this, all of these things apply to the influenza season too and any other bugs that we have as well. Making sure you're washing your hands and disinfecting high-touch surfaces and things like that. Okay, phones especially. And then if you're, obviously if you have a lot of food substances on your counters or those sorts of things, you'll just want to clean those first with your normal soap and water and then go back and disinfect afterwards. You want to just get away that gross material before you start to disinfect. And then monitor yourself for signs and symptoms. Actually, let's step back to this part right here. In the hospital itself, depending on what environment you're going to be working in, you will receive education on how to disinfect your area. We are now experiencing shortages of our normal, what we usually use to disinfect, like those purple top cloths, purple Santa Claus, those types of things. Bleach cloths, all of this is becoming in short supply now. Christy Malakis is our director of purchasing. She does a great job too. These things are just not out there. So what we've had to do is move towards more of the disinfectants that the EVS staff use, our environmental staff use. So that means spray bottles, more things like that, things that just aren't so convenient to use. But you'll get education on that. So for a Virex, you'll have a spray bottle, spray the surface, let it sit wet for 2 minutes, and then wipe the excess off after that. If you're wiping down any type of equipment, saturate a washcloth with the Virex, wipe it down, making sure that those surfaces on the equipment stay wet for 2 minutes, and then you can remove the excess. those types of things. It'll just be a little bit different kind of flow in how you're used to cleaning. Same thing with wheelchairs and those types of things. Does that make sense to everybody? All right, now also we need to be vigilant about watching our temperatures and also for signs and symptoms. So as volunteers here, we're all grateful for your help and we've missed you. Before you come in each day, make sure that you take your temperature and see if you're not feeling well. A little tired today. They have a little muscle ache, those types of things. If you develop any symptoms at home, please let Kathy know, but do not come in. And then follow up with your primary care physician. If you were to develop symptoms here, you do your temperature check when you come in, but later in the day you say, oh, I don't know, I feel a little hot. And then you go and your temperature's over 100, or you say, oh my gosh, I'm feeling achy now. Once again, let Kathy know, and then we'll send you home, and you'll follow up with your primary care physician at that point. Okay. Any questions on that? Okay. Facts about temperature taking, obviously we all know, don't take it after you've had coffee. Don't take it after you're really active outside. It just naturally your body temperature raises with that type of stuff. And then also, if you want a true reading of what your temperature is, it's best to do it without any type of medications at all. Anything that would reduce that. Okay. So, what will you need to do as a volunteer when you come in? Obviously wear your face mask at all times. Just want to talk a little about how you handle face masks. Will we get them like paper bags or whatever if they want to put them in there, while they're by themselves?
We can do that.
Yeah. So always from back here.
I've been hanging them in the gift shop.
Yeah.
On a hook.
Yeah, I saw yours in your office.
Yeah,
But just depending on where they're at.
yeah, because they could do it on the other side of that same spot.
So touching back here, this is considered not contaminated. The front of the mask is considered contaminated. You don't ever want to touch like here. Take it off. Just here. And then take it and put it into your bag. Or on a clean paper towel, whatever you've decided you want in your area. Once again, no touching the front. And then back on. Please wash them daily. As you can see, Mike has makeup on it. So make sure that we're doing that. Okay. And then if you're working in closed areas, this really doesn't apply. We're not going to get you into those settings. I just kind of wanted to reinforce that. In clinical settings, we wear more of the isolation or procedure masks, the yellow or blue ones. Non-clinical settings, cloth-based masks are good. All right. We're going to perform hand hygiene between interactions with each patient and visitor. And then clean the high-touch surfaces, which we already went over. So that's it. Boy, that took a long time, maybe because we had that little break in the middle. Any questions for me at all? I'm happy to try and answer. You're good? All right, thank you, everyone.
Thank you, Leslie.
Woo.
Nice job.
A lot of